everyone. Assalamu alaikum, ladies and gentlemen. Welcome to another exciting episode of the Swanky Doctors podcast. This is your host Ali Heather, and today we have a very special guest with us all the way from United States, Dr. Anas Sohail, who is a family medicine resident at Carl Care Hospital. Dr. Anas, welcome to the show, and thank you so much for joining us today. It's really an honor to have you on our show.
Thank you, Ali, for having me here. I'm happy to be here.
Okay. I got to know about you. Actually, a couple of months back, I saw a video of yours where you shared your match reaction on YouTube. So I saw that video, and that was the point that I knew that this is the guy that I want on my interview.
Wow. I appreciate that. And I have a question. So I actually have three reaction videos
Okay.
because I didn't match. So which one did you see?
The one where you didn't match, that was the time I started following you, and then I saw the match one, so I was like, oh, okay, finally this guy is done with the MLE, and now Alhamdulillah is into the residency.
Appreciate it. Thank you.
Dr. Anas, we will start the conversation with few basic questions like where were you born and how was your early life like, and where did you get your early education from?
Yeah, great stuff. So born in Saudi Arabia. My early life was basically a lot of moving. So from Saudi, Dubai, Pakistan. But when I was 5 years old, we came to Canada. So from there, I grew up from there. Now, here's the thing. So related into like the whole medical side, I think even maybe in Pakistan and some other places as well, it's like you do after you finish your high school, you do like 2 years college and then go into med school, correct? So here it's like you do your high school, then you do 4 years of undergrad, then you're MCAT, and you maybe will go into med school. Maybe. So for me, that was like, no way, I'm not gonna do 4 years to do an MCAT to maybe go into med school. And if it doesn't work out, then what do I do? Then I have to move the country anyways. So I was like, let me, right out of high school, I went to a combined undergrad and medical school program. And so that's kind of how I got into the whole med school, like from a more earlier age. So I think that was like part of the question, right? Like where I was born, the upbringing part, and then
when did you guys move from Saudi to the States?
Like when from Saudi to the States?
Yeah.
So there was a progression. So it was like Saudi, Dubai, Pakistan, but that was a lot of just moving. And then Canada. So I'm actually Canadian. So that's why I'm a non-US IMG. And I'm in the States essentially because of my clinical rotations from third year of medical school onwards. And then when I got the match, of course, it was in the States. So that's how I actually ended up here in the States. But my family is in Canada.
Okay, that's great. Dr. Anas, can you please shed a light on the life like in med school? Like how was it like, and what are some of the extracurricular activities that you were involved in during your undergrad days?
True, man. So essentially, since my undergrad and med school was combined, I guess like extracurriculars were really school related. They were not really outside of school. So little things like health fair, like where we would basically get the people on the island, give them free checkups, we couldn't give them like medical advice, like real medical advice, but we can tell them, oh, this looks off, you should go see a primary care physician, or, you should go see a specialist or whatever. Prior to that, however, to even get into med school, yeah, of course, you have to do the extracurriculars. So I would volunteer at like a retirement home. That was like a big one. Volunteering at the mosque was another one. Anything to show that like, you're active beyond just the academics, because really everybody's going to come in with at least, average to good grades.
Yeah.
So how are you going to stand apart, right? Like, what are you doing a little bit differently? So, yeah.
Okay, Dr. Anas, can you please tell us that what was the inspiration or what inspired you to join medicine?
Great question. And honestly speaking, initially it was my parents.
So just like every brown family.
Exactly. I'm not gonna tell you, oh, this like crazy story. Yeah, sure, things happened afterwards, but the foundation 100% has to be specifically my father, like 100%. So he was very adamant on, become a doctor. There was no doctor, engineer, lawyer. It was just doctor. That's it.
Okay.
So at first I was like, oh, why doctor? Like, so I tried to be, I'm gonna do policeman, I'm gonna be ice cream man, I'll be anything but a doctor, right?
Okay.
Um, but then down the line, as you go through school, people will tell you like, oh, being a doctor is so hard, being a doctor is so difficult, and all this. And I'm like, oh, I'm not dumb. Like, you know what I
Okay.
mean? Like, it's kind
Yeah.
of like a challenge. It's like,
Yeah, exactly.
people think it had such a high expectation of a doctor, and it's like, and my father would even say like, वो भी तो इंसान होते हैं,
Yeah.
तो क्या मैं इंसान नहीं हूँ? Like,
Hmm.
you know what I mean? So if they can do it, I can do it. And to some degree, I was naive.
Hmm.
I was naive, so in the sense that like I didn't know about the Caribbeans. I didn't know about, all I knew was I need to become a doctor. I don't know how I'm gonna get there, but anything that sounds hard, I'm gonna do it. So any science course, any math course, even if I don't need it, I'm just taking it because it's hard. And everybody told me being
Yeah.
a doctor is hard.
Last
So
night I was talking to Dr. Hassam, who is an MD too, and he was saying that same thing, like that he wanted to do the toughest thing that was available.
literally, and part of it, to be honest, was this naiveness in me that I could have looked it up. Like, what do I
Mhm.
really need to learn? But
Yeah.
my idea was if it's hard, then that's what I need to do to become a doctor. And honestly, it helped because it builds a foundation, right? Then now you have to study. Now you have to like, not play with your friends some days and stuff. And you learn those like good habits.
Yeah. Okay, Dr. Anas, that was good to hear. Can you please share your USMLE experience and the entire match experience you went through?
Yeah, for sure. So for USMLE step one, I would say initially I was not very well prepared. Like basically not knowing what resources to use, and I was doing like I was doing Kaplan course. I'm doing Kaplan Q Bank. Obviously, everyone does first aid. Doing Anki flashcards. It's like too scattered. There's too much stuff to cover, not enough time. And then when I finally got down to the flow, it was just basically U World. Like,
Okay.
don't overcomplicate anything. Just do U World, and when you finish U World, do it again. And when you're done and you have time, do it again.
Okay.
Like literally, if you can just do it over and over, you'll be good. Now, specific things like if you know there's a subject, you keep getting it wrong, fine. For that, go on YouTube, find a video, learn it a little bit more in depth,
Mhm.
but don't waste time like trying to learn everything A to Z because you just don't have that much time.
Okay. Okay. And what about step two and step three?
So those were much better because now that I know that what the foundation was, and this is more so step two. I'll get to step three in a second. So step two, knowing that yeah, UWorld is what I need to do. So not much different except now I didn't waste as much time because I
Yeah.
already had the plan. Um, so not much more comments there. But step three, and I'm gonna tell you guys this very honestly. In fact, I was going to do this whole video and everything, but we're gonna drop it right here, okay? We're
Okay.
gonna drop it here. So, um, first time around, I didn't end up matching, right? This is
Yeah.
basically last year. Didn't end up matching. I was like, okay, what's the first thing that you do when you don't match? Um, how do I improve my CV?
Mm.
So number one thing I wanted to do was write my step three. But at the same time, that's not the only thing. I was like, let me do a bunch of research projects. Let me do a bunch of rotations. So I ended up doing like, I went from 2 publications to 11. I
Okay.
ended up doing 5 externships, um, like going to a bunch of conferences, doing everything I can. It was just like, I was very scattered.
Mhm.
On top of that, I'm like, let me just finish USMLE step three as fast as I can. And I got some advice, which a lot of people will hear this. And I'm gonna tell you, like, don't listen to this advice, which is like everyone goes, oh, step three is really easy. It's really easy. You just have to pass. You just have to pass,
Mhm.
right? Maybe it'll work for you, but I'm the type of guy, I've never studied for an exam just to pass. I've
Yeah.
always studied for an exam to do my best. So during my practice session, as soon as I was starting to pass, I was like, okay, that's enough. I just need to pass, right? So
Mhm.
going to the exam, and what ends up happening?
you get
fail.
Yeah.
Yeah. I was shocked. I was like, that's it. My life is over now. I already didn't match. Now without step 3, it's over. My life is done. Right. So it really like bothered me. Like it affected me. But what can you do, right? So the only other thing you can do is try again, study for it, and give the exam. But in my mind, I was like, I have to think about plan B now, maybe move to a different country or something.
Yeah.
But yeah, that was my step 3 experience. So the point that I want either you or the audience or whoever to really understand is, if your study style worked for you in step 1 and step 2, don't change it all of a sudden in step 3. Stick with the same program, because you don't want to find a result that you didn't want to have.
Okay, that's great. Dr. Anas, what are some of the reasons that, according to you, may have played a part in staying you unmatched in the first cycle?
Factors. Oh, so first cycle, the first one that comes to my mind is not having my ECFMG certification on time. I would have had it on time, but this was COVID era, right? So everything was delayed. I got it in the mail 1 week after rank order list.
Okay.
So for them, when they're ranking you, I can understand from a program director's perspective, what if he doesn't get it before the time for him to come? Now we're one spot short of somebody who was supposed to be here because of visa issues now. So make sure that you get your paperwork and everything done, not on time, but get it done early. If you get it done early, then there's no objection. In my case, I got it a week later, and I think that was the biggest factor, because you don't like, what if things don't work out, and now what? Like, so I think that's the biggest one for the first match.
Okay. So as per my knowledge, you have worked as a research assistant as well. I would like to know that how was that experience like, and how can one find such opportunities if one doesn't match?
So I would say the biggest ways to do it is well, in my case, I was alhamdulillah very blessed. I put my failures out there. The same way you found me, right? You found me through not matching. And I remember when I first, and I'm going to answer the question, but I'm going to give you some background here. When I first posted it, I had some people, even close family members, like, why are you putting that? Like, it's embarrassing, like, all these things. And it's true. It's true. Even I felt embarrassed. It's like, you did all this work, you did all this, and what am I posting that I failed? It was bad, but that was part of me. And then the other part of me is like faith, like, no, it's gonna happen. I'm going to match. I'm gonna match. And it's like any movie or any story, there's always the downfall before something good happens. And I just believe, like, it's gonna happen. It's gonna happen. I don't care. Like, I just believe it's gonna happen. And alhamdulillah, I did. And so, and the reason I mentioned this point is, the question that you had asked was, remind me what the
How
question
was that entire research experience like?
The research experience, right? So during that process, then, because I posted my story online, not only was I reaching out to people, but people were reaching out to me.
Yeah.
And so I had people basically saying, like, oh, I want to help you try to, like, match, and the different stories. But in terms of research specifically, I was reaching out to people on LinkedIn, especially. Anyone who had been getting into, like, posting research, like, oh, they just posted this. How did you do it? Who do you know? The biggest thing that I found was this company called Research Update. Research Update is the name of this company. And essentially they teach you how to do research, and then they help you do a publication. That is a great benefit, because one, you actually learn how to do it, because I didn't have, like, strong research experience. I always had a mentor to guide me. So it's not like I understood it very well. The second thing is they help you publish some research, but that's not even the gold. The gold of that, being in that program, is that you end up finding people who are very excellent in research. And and then you build connections with them, and then you talk to them, same thing over Zoom, on WhatsApp, you go to conferences with them, you start to become part of that group. And
Yeah.
every time someone has an idea or something, you work together and you start publishing research. This is how I went from 2 all the way up to 11.
Okay, okay. So, if unfortunately someone fails to get matched in the first cycle, what are some of the venues or what are some of the opportunities that are available where he can polish his skill further to improve the chances of getting matched in the next cycle?
Okay. This is a great question. Now, everything will help. A little bit of everything can help. Like I said, like in my personal case, it was trying to do the step 3. Now, even though it was unsuccessfully, like for some people, it could be successfully, right?
Yeah.
So that's a big one. The other ones would be getting more experience. So showing that you were still active. You weren't just like, oh, I didn't match, let me just reapply next year, but you have nothing that you showed for it in between. So doing externships in the specialty that you want to go into, right? So
Okay.
you will have updated LORs, you will have new, like it shows that, oh wow, like he still kept going, like, so that's one. Some people go into medically related fields. So maybe, you might have some financial difficulties and, you can't be doing these free externships. And so fine, no problem. Maybe get a job as a research assistant or something that's medically related so you can still, have your roots. But the big thing is making connections. Your
Okay.
connections will take you very, very far because at the end of the day, all it takes is the good word of mouth. I know him, I can vouch for them, blah, blah, blah. And they give you a chance and you can
Yeah.
actually prove yourself. That's it. So this is why
Oh,
conferences was a huge one. Like for me, there was a conference in Atlanta. I think the drive for me was like 14 or 16 hours.
okay.
Like I was like, oh, it's next week. I had just a few days notice. I was like, done. Like I'm packing my bags. I'm like ready to go. Like everyone's like, first I looked up flights. I was like, oh, I'm not paying $1,000 to fly. Like no way. So I just packed up my bags. I was ready like to go. I was like, it doesn't matter where it is. Go. I'm gonna talk to everybody there. I don't care if I'm embarrassing myself. I don't care like what it is. I have to match this year.
Okay.
Hi, my name is Sohail. I'm trying to apply to blah blah blah. Hi, doctor. Hi. Hello. Like I was going crazy in all of these conferences, and believe me, I have a whole list of just a bunch of contacts. And
Okay.
the thing is, despite all that, it might not work out, right? But it's better than for you to just sit at home and be like, oh, I didn't match. Inshallah next year ho jayega. Like,
Yeah, okay.
you know what I mean?
Yeah, exactly. Dr. Anas, can you please tell us that why did you choose family medicine? Like mostly IMGs apply for internal medicine, right? Can you please tell us what's the scope of this particular specialty and how is it different from IM?
Oh, FM versus like the differences and why I went into it, correct? Okay, perfect. So FM, honestly, I know some people think, well, maybe I'm biased because I'm in it and stuff, but no, it's for me has been amazing. I love FM because I was during med school when I was doing all of my clinical rotations, I liked a little bit of everything. So in my mind, even growing up, when I thought about a doctor, I always imagined that there's somebody who does everything. I didn't really think about the fact that, some doctors just do one thing and that is their like, specialty or whatever. So for me, one, it fits my idea of what a doctor is. And then two is you get a little bit of everything. So one room you're going in, it's like, a pregnant woman. Another room you're going in, they're about to go into surgery. You go into another room and they're depressed. Like it's just changing. So you're never bored and you're not just talking about the exact same thing over and over, room to room. So that's one. And then, so yeah, grand scope. And then two is that family medicine you can do so much with it. So a lot of people will think you just do in the clinic. You're just going to be a doctor in the clinic and dealing with like cold and flu and stuff. Like it's not just that. Like so many family medicine doctors are hospitalists. So they literally work IM jobs, but are family medicine trained. Then the additional benefit of those family medicine doctors is, So usually in the States, like when you're a hospitalist, you do like 1 week on, 1 week off. So you work for 1 week, then you're off for a week, then you're on. So, but some internal medicine doctors, let's say they're not clinic, right? They don't have any clinic that they work in. They're just hospitalist.
Mhm.
They can't pick up another week of hospitalist because then they'll be working full time. There's no break.
Yeah. Yeah.
But family medicine is different because you are trained with kids and pregnant ladies. You can pick up shifts in urgent clinic in that
Okay.
week, right? Maybe you don't need a whole week off. Maybe you just need a couple days.
Mhm.
But your scope is so big that you can go into urgent care, you can be a hospitalist, you can work in the clinic, and even above that, if you're not in the city, if you're a little bit away from it, you can work in the emergency department as an emergency doctor.
Okay.
So family, the scope is just so big that like my personal opinion is if you are not trying to become a specialist,
Mhm.
like if you're not trying to become like a cardiologist, nephrologist, or whatever, then and you just want to be like a general doctor, go into family
Yeah.
because you have more options. But if you want to be a specialist, then go into internal medicine.
Okay, okay, that's great. Is there any fellowship option available after one gets done with the family medicine residency?
Yeah, there is. So there's a few different options. They're not like organ based like the way IM is, you know,
Mhm.
with the pulm and cardio and nephro and whatnot.
Yeah.
Like you can become a sports medicine doctor.
Okay.
So that's one, and they have, you know, more scope in terms of procedures. But even then, you could even do that as a family doctor. You don't even have to specifically be sports, but you
Okay.
know, it's a specialty.
Mhm.
Then you can do 1 year of like emergency medicine. So now you're trained, you have like training to work in an emergency medicine. You don't even have to go into it again. But some people feel like they don't have that level of experience during their residency training, so they do a year of fellowship in emergency.
Okay.
You can go into geriatrics, and I know internal medicine can also do geriatrics, so there's not a like a difference there, but it's a specialty. You can go into
Okay.
sleep medicine. Um, there's a few more, but like they're usually they're not specific like organ based, but there are specialties available.
Okay.
But even if you didn't go into those specialties, you could still do that as just your base like family medicine doctor training.
Okay, that's great. Dr. Anas, can you please tell us that is family medicine an IMG friendly specialty or not?
Oh yeah, yeah. Well, you know what? Like I can say this based on obviously when I was applying, you know, looking at well, what are the most IMG friendly specialties.
Mhm.
At the end of the day, I think if you really have a passion or you really want to do a certain specialty, don't just think like, oh, because I am an FM or IMG friendly, I'm not going to go into surgery or whatever, right? Like go into really what you want to go into. And I know everybody says just apply to one specialty and blah, 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 but like really like if you really like surgery, go for it. And if you have that extra money to also apply into something else, then yeah, do it. Like you don't have to tell everybody this, but you know, like
Okay.
yeah, but at the end of the day, they are IMG friendly specialties. And even like when I see some of the hospitalists and whatnot, they tend to be people that are you know non-US grads.
Okay, okay, that's great. Can you please tell us about a particularly rewarding experience that you had during
For
your medical training, like while treating your patients?
for sure. That's a great question. So I thought of like two specific stories, but I would say like the first one, let's say, is like this one patient I have who has lost over 30 pounds just by listening to some advice, right? And the thing is like the reason why this is so rewarding is like you could have been saying the same thing as like a normal dude or like as a med student maybe, and people would not have taken it as seriously.
Yeah.
But because you are now their doctor, like some patients will literally say it, like, I will listen to whatever you say, you are my doctor.
Yeah.
And you're like, oh yeah, I am a doctor. Like, you know, you remember like you hold that much like weight, like your advice, your prescriptions and whatnot. So and I bring this patient up because literally he has lost over 30 pounds, and the advice that he had gotten was simply just walk. walk an
Okay.
hour a day, and he's been just walking and walking and walking, and it's just like he has literally dropped that much weight.
Okay.
And so it's like little things like that are really rewarding to see, like your
Okay. And
advice is actually making an impact. Like, wow, people are actually listening.
Okay, okay. So, can you please tell us what's the story behind Talks by MFA? Like, is it live now, and what's the update about it?
So the way Talks by MFA started was I wanted to, while I was still a medical student, I wanted to give people talk therapy
Mhm.
um, as a form of like psychotherapy for people. So I started this page, Talks by MFA, and originally I was posting like tweets on there. Like I'd screenshot my tweets and then put it on there and basically giving life advice, right? But I wanted to basically consult people and do one-on-one coaching and training and give people this like positive mindset so
Mhm.
that they feel more empowered and better about themselves and more hopeful. So
Okay.
I find out though later, I was talking to like this lawyer and I was trying to make this into like a real business. Um, and I found out that I can't actually give people this kind of advice. I'm not a licensed therapist. I'm still a
Okay.
medical student. I'm not a doctor yet.
Mhm.
And I was just a third year med student at the time. So
Yeah.
the thing that I had been told was you can literally get sued.
Okay.
So this Talks by MFA, like that dream just kind of like went out the window. I was like, oh no, like so essentially the way I had to market myself or brand myself is like the idea still remained. I still wanted to do what I want to do, and I kind of do in some sense. Um, but I I couldn't advertise it. I'm not giving you advice, I'm giving you information. And
Okay.
now you do whatever you want to do with that information. So
Okay.
that's kind of how it all started. But then eventually I basically also used it as a platform to just showcase the journey because I started making the vlogs and yeah. Well,
Mhm.
actually, I had been making vlogs already, but I had never posted them. They were all, and even I have hundreds of videos now that I have yet to post. But I started putting them together, and that was where I started posting them.
Okay, I would like to come to that part. Like, how's the day like in the life of a family medicine resident? Can you please shed a light on that part?
Absolutely. Every day, I will say every month is extremely different because every month is a new rotation. Today, I
Okay.
actually started orthopedics. So I'm on a whole new building and everything.
Mhm.
But on a daily basis, um, it's just a bunch of different things going on. Like I'll give you example yesterday, right? I
Mhm.
was in a OBGYN clinic taking care of, a pregnant lady there. Then I go to my own clinic, like where I'm taking care of my own personal family medicine patients. Then from there, I'm going to the surgery clinic because I'm on a surgical rotation, taking care of surgery patients. Then we're on call. So then we get a consult. So I'm going to the emergency department, doing a consultation for somebody who might be having surgery in the emergency department. And then, going home, going to the gym, coming back, like it's just, and then, make, obviously day-to-day life, make your own food, blah, 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 all this stuff. So
Okay.
every day is something, man. It's just something.
Okay, okay. Here, I would like to conclude the discussion. Just one last question. Like, is there any last piece of advice that you would like to give to someone, especially an IMG who is planning to pursue a career in medicine, especially in the US?
Yeah. Like if I could do one advice, I'm just gonna say whatever comes to mind, man. And let's see where this goes. Essentially, I would say, um, have faith, right?
Mhm.
Just believe, like, especially, and I'm assuming a lot of viewers will be like, Muslim or, but regardless, whatever your faith is, just have faith that it's going to happen and believe and just keep trying to do it. Don't like give up or like be like, oh, it's not for me or I'm not cut out for it or whatever. So
Mhm.
just keep on going, really, and connections. Like even the people that you think like, oh, like I don't know them too well or blah blah blah. You have no idea. Like maybe in the right time at the right place, that person just likes something about you and just makes a comment to like some resident, some program director, and then they give you a chance. You have
Okay.
like no idea how things will work out. So just put yourself out there, and most times believe you will get rejected. So if you
Mhm.
already know that most times you're gonna get rejected, like the fear is gone now, right? So essentially,
Yeah.
you just that one person to just make it happen.
Okay. Okay, that's great. Dr. Anas, there's a personal question as well. Maybe I will cut this part out. So lately, I've been thinking about this, that most of the people here in Pakistan have got strong religious affiliations, and they have got some family values too. But if one moves to the United States or any Western country, I feel that all these values get in danger, or maybe there's a chance that a person may not be able to practice those values as he might have wished. So how do you see this entire thing, and what's your take on this?
That is actually such an excellent question. Like, and मैं इसलिए कह रहा हूँ चूंकि मैं भी ये चीज़ें सोच रहा हूँ, especially आजकल about all this. I think biggest most important thing is आप किसके साथ घूम रहे हो, फिर रहे हो, कौन आपके ग्रुप में,
Yeah.
अगर you're in a group with like a lot of Muslim people and people with family values, then you're going to become like them, right?
Okay.
If your group is people who's always partying and blah blah blah, then you're going to start to become like them. In general though, in just Western countries in general, चाहे वो US हो, Canada हो, या जहाँ पे भी, I can see that like it is there's a lot of temptation, and what media, TV, and all this stuff, it's normalized. Like it's very normal to be like just I guess like just
Yeah.
non-traditional essentially.
Yeah.
So if you अगर end of the day अगर आप अपनी values समझते हैं, then you just have to avoid ये चीजें. Okay, not to go certain places, not to do certain things.
Yeah.
And really अगर आपको है कि शायद आप बच सकते हैं, लेकिन शायद आपके बच्चे,
Yeah. That's the
चीजों से,
prime concern here.
and same thing, this is why, इसलिए मैं ये especially आजकल सोच रहा हूँ कि चलो मैं फिर भी चीजें समझ सकता हूँ, लेकिन बच्चे कैसे समझेंगे? क्योंकि अगर आप कुछ बता रहे हो उन्हें और
Yeah.
टीचर कुछ और बता रहे हैं, फैमिली कुछ और बता, आई मीन मीडिया कुछ और बता रही है, उनके दोस्त कह रहे हैं डिफरेंट चीजें, तो फिर आप बुरे हो गए एसेंशली कि आप तो कैसे आपकी सोच पुरानी है, या ये है या वो है.
Yeah.
तो रियलिस्टिकली अगर रियली वो कोई मसला है, देन इफ यू आर ओपन टू इट, लाजमी नहीं कि यूएस ही एक जगह है जहाँ आपको डॉक्टर ही बनना है, या कनाडा है, या यूके, डिफरेंट जगह भी हैं जैसे दुबई, ओमान, यूएई कंट्रीज, एंड रियली उनके पास रिसेंटली मैं भी ये चीज़ आजकल देख रहा हूँ कि पे वहाँ पे भी इज रियली गुड. वहाँ पे टैक्स नहीं है, वहाँ पे कॉम्पेंसेशन पैकेजेस हैं, लाइक ऑप्शन सिर्फ ये नहीं है कि आपको यूएस ही आना है, और वहाँ पे और फिर इसके अलावा फिर इस्लाम है, मोरालिटीज है, फैमिली चीज़ें. सो अपने आप को जैसे एक्सक्लूड नहीं कर देना कि यही एक ही जगह मुझे जाना है. इफ यू वांट, यू कैन मे बी, हो सकता है ट्रेनिंग के लिए कर लो रेजिडेंसी, और फिर देख लो अपने दूसरे ऑप्शंस when you become fully licensed.
Okay. Okay. Thank you so much for sharing your insights with us, Dr. Anas. It was really nice having you on our show, and I really inspired by your personality.
I appreciate that. Thank you so much, Ali.
Okay, here I would like to end the discussion. Thank you so much to all the viewers who have watched the episode till the very end. Join us next time for more exciting conversations. Until next time, Allah Hafiz.